Hi, I'm Dr. Hatem Abdul Hussain. I'm the new CEO of Health Innovation Kent Surrey Sussex, which is part of the Health Innovation Network, commissioned by NHS England and the Government's Office for Life Sciences. I first joined Health Innovation Kent Surrey Sussex around 18 months ago, when it was one of the academic health science networks, and they have recently been renamed as Health Innovation Networks, which is great because it explains more clearly what we do. I've really enjoyed working on local innovation programmes, particularly in Sussex and Surrey Heartlands, which are a couple of the integrated health and care systems that we serve within the region. Alongside that role, I also still practice as a GP, and I will continue to do so whilst being CEO of this organisation. I spent the last few years working nationally, previously at Health Education England and then NHS England, and leading on AI and digital workforce. This is really exciting because these technologies are going to critically change the way we practice in the future. The Topple Review was very clear on this, and being able to understand what that means for the health and care workforce, make sure that the health and care workforce has the right skills that it needs to be able to use those technologies and think about the productivity savings that we can gain from the use of these technologies has been great. And I look forward to bringing that learning into this new role. My priorities as CEO of Health Innovation Kent Surrey Sussex is to truly establish ourselves as a leader for innovation and transformation within the region, and be able to work with our local health and care systems to define what our priorities should be, and then take that learning further within the Health Innovation Network so that we can truly scale the innovations that work across the country. I also want to make sure that we bring investment and growth within the region. The southeast of England sometimes is forgotten, and investment often goes elsewhere. And yet we have a significant population across the region, in Kent and Medway, in Sussex and in Surrey Heartlands, and lots of green shoots of possibilities and economic growth. So I want to work with our startups, I want to work with our industry partners, I want to work with the innovation centres within the region to be able to bring that growth further. One of the challenges is that our health and care system is under significant pressure. I know that as a GP, I have patients that are telling me they're really struggling to get an appointment with me. I have colleagues that are increasingly burnt out. In fact, the data from the Commonwealth Fund shows that GPs of my generation have significantly high levels of burnout, with about 1 in 2 of the workforce experiencing burnout. And so I want to make sure the NHS is a better place to work. I want to make sure that we use technology and we use innovation to release some of the pressures that exist on us, to be able to help us deliver a better service to our patients and ensure that they have a better experience and outcomes, and to join up health and social care as well, because we know that actually a lot of the factors that affect healthcare are wider than health itself, are other social determinants of health. So things that can lie with our social care system or even our local authorities more widely. And I'm very keen that we try and plug that gap, and that's one of the challenges that we need to overcome. I'm also keen that we as a country invest more in innovation and in real world evidence. There is no doubt on our investment and spending in this space is incredible, but we need to then readdress that balance, because if we're going to get those innovations, those R&D opportunities into practice, we need to be able to have more translational research, more translational activity, and I want us to be that bridge between what we see in evidence into practice. I'll be looking to share the CEO diary on a monthly basis, so I want to be able to engage with you actively. Please make sure you do subscribe to our Health Innovation KSS YouTube channel. I'm very keen to hear any feedback from you, and actually ideas for future videos would be great. I'm open to any conversations that will help enable the spread of innovation. Ideally for me, that would be a cookie. Having said that, I try to be quite healthy during the week these days, so my usual pick-me-up is a coffee or a kombucha.